Hello guys, welcome back. Today we will discuss about other psychiatric topic, that is dissociation and conversion disorder. In last videos we had a discussion regarding somatoform disorder. So somatoform disorder is also a part of this dissociation and conversion disorder. So we will see what is dissociation and what is conversion. Is there any difference between dissociation and conversion? So dissociation, that is the first step or first session of dissociative conversion disorder. Dissociative disorder is characterized by disconnection from thoughts, memories, consciousness and identity. So in dissociation part of dissociation conversion disorder, you will lose your memories, thoughts, identity, consciousness for some period of time. So the primary symptom of dissociative disorder is psychological symptoms. So psychological symptoms are the primary symptoms of dissociative disorder. And dissociation gradually leads to the next stage, that is conversion. In conversion part, you will see physical symptoms without any physical illness to explain or without any medical reason. So that is conversion. So dissociation means physiological symptoms will not be there, only psychological symptoms we can see, like loss of memory, loss of consciousness. And in conversion part, you will see physical symptoms, but if we go for a checkup or if we go for a diagnostic procedure, you will not find out the medical or physical reason behind this physical problem, like paralysis will come suddenly, vision loss will come suddenly, hearing loss will come suddenly, but you will not understand the reason. If you go for a checkup, the doctors cannot identify the reason behind this physical pain. Okay, next thing is in detail, if you see what is conversion means. In conversion disorder, we have physical symptoms of health problem, but there is no prominent illness to explain this physical illness and physical symptom. For example, again, I will tell you one more example. If you have pain, okay, you are going to the doctor with pain in one part of your body, you cannot shake, you cannot move that part of the body. So doctor will do a detailed checkup, but after the checkup also he couldn't find out what is the reason behind the pain. But you or the doctor also will not feel that you are faking it. So that situation is known as conversion disorder, and it is happening because of the emotional conflicts, emotional problems, psychological problems which you are facing inside your mind. So these problems, emotional conflicts are coming out in the form of physical symptoms. That is the actual thing happening in dissociation and conversion disorder. And the researchers are telling that it is more in women comparing to men. Then, according to American Psychiatric Association, there are some specific set of standards for the symptoms of this conversion disorder. It include problems in the movement or senses, and you can't control this. That is the first thing. Next thing is they can't be explained by any other medical condition, and there won't be any medical or mental health reason behind this. And they causes stress in social work setting. So there won't be any mental health problem related to that. They can't be explained by any other medical condition, and the problems you can see in your movement, senses, and you can't control these problems. Okay, so these are all the set of standard by American Psychiatric Association. And while coming to the types, we can see three types of dissociation and conversion disorder. They are dissociative identity disorder, that is formerly known as multiple personality disorder. That was the first name of this dissociative identity disorder. Now it is known as dissociative identity disorder. Second type is dissociative amnesia, and third one is depersonalization or derealization. Okay, so first we will see what is dissociative identity disorder, that is otherwise known as multiple personality disorder. Multiple personality disorder means the person have two or more distinctly different identities or personalities, and one personality is not aware about the presence of other personality. So you will see different type of personalities, you will show different type of personalities in different times. So what is personality? Sum total of your behavior, that is personality, right? So you will show different type of personality in different time, and one personality won't be aware about the presence of other personality, and that interesting thing is multiple personality disorder. So here the psychological symptoms and physical symptoms also we can see. Then dissociative amnesia, that is other type. You know the meaning of amnesia, right? Amnesia means what? Loss of memory. So dissociative amnesia means unable to recall the information about themselves, followed by psychological and physical trauma. That is dissociative amnesia. Next is depersonalization or derealization. Depersonalization, that means you are not understanding the personality what you have. Derealization, you can't understand what is actually happening in this world, like what is existing. They have a lot of questions always, those who have depersonalization and derealization. They will always ask themselves like, who am I? What is the thing I am doing right now? Whether this world is existing, or what is the meaning of this earth? What is the meaning of the society? What is the meaning of human animal? What is the meaning of social animal? Whether I am existing in this world, whether the world is real, whether the society is real, whether the people are real. So a lot of questions always they have. So that situation is known as depersonalization or derealization. And apart from that, some more type of dissociation and conversion disorder we can see. Among that, first one is dissociative fugue. In dissociative fugue, you will see dissociative amnestic symptom like loss of memory, loss of identity. Apart from that, one more thing we can see in dissociative fugue, that is you will travel away from the place where you are presently living. Okay, and purposeful travel you can see here. You will purposefully travel away from the normal place where you are living, and you will adopt a new identity in new place. Quite interesting, right? So you will purposefully travel from the place where you are staying, and you will go and take other identity, and you will stay in that place for some times. Okay, that is dissociative fugue. So actually why? Because it is happening means it is because of the emotional conflicts and the problems which is there inside your mind. You don't know how to express the problem, so your mind and body will work together, because there are only two friends, best friends in this world. They are your mind and your body. So your mind and body will discuss the things together, and for your mind your body will work and will do this dissociative fugue activity. Next is dissociative stupor. In dissociative stupor, it is characterized by lack of movement. Your movements will stop suddenly. All the movements will stop, and you will sit like a stone. You will not show any response to us. Light is coming, voice is coming, some sound is coming, whatever it is. Okay, you will not show any kind of response to us. That like a statue, like a stupor stage, you will be there always. That is known as dissociative stupor. The emotional problems will make you stoop. The emotional problems will make you like a statue. You will not show any interest towards anything. Next is trance and possession disorder. Trance and possession, from the word itself you will get the meaning. Trance and possession, that means it is characterized by temporary loss of your personal identity, but you are completely aware about the surrounding. That means if I have trance and possession disorder means I will lose my identity, I'll lose my name, I'll forget my name, I'll forget the existence of me, like who am I? Okay, my age, my height, my weight, my gender, everything I'll forget. But I'll be aware about the surrounding, like where I'm staying, okay, where I'm standing, where I'm living. That is known as trance and possession disorder. Next is dissociative motor disorder. Dissociative motor disorder means sudden paralysis will come, like monopara quadriplegia, that means paralysis. Sudden paralysis without any reason. Normally you know how the convulsion will occur or epilepsy will occur. How epilepsy will occur? Epilepsy will occur due to abnormal discharge of electrical impulses from various parts of your brain. And that is the reason behind convulsions and epilepsy. Okay, the same symptoms the patient will mimic. But if you go for a checkup, if you do an EEG, you cannot find any abnormal discharge of electrical impulses from your brain. So that is dissociative motor disorder, and this problem will increase when the attention is redirected from the patient to others. Actually, it is because of the attention problem and all emotional problems, emotional conflicts, and to get the attention, the patient will show more dissociative stupor. And you are not faking, actually your mind and body will work together and it will happen. And when the attention is reducing, like that, a feeling it's coming, the patient is getting that kind of feeling, means automatically the symptoms will increase. That is dissociative motor disorder. Next is dissociative convulsion, and that was formerly known as hysterical fits. It means mimicking the symptoms of epileptic seizures and partial loss of consciousness. Next is dissociative anesthesia and sensory loss, and it is characterized by disturbances like lack of senses like vision, hearing. You will not get any senses, like if you're touching, you will not understand someone is touching. If making lot of noise, you will not hear the voice, you will not feel anything different there. Okay, and too much light is coming, you will not feel that too much light is coming. So that is known as dissociative anesthesia and sensory loss. If someone is pricking with needle and all, you will not feel that effect, like that pain. So that is dissociative anesthesia and sensory loss. So what is the cause of this condition? So what is the cause of dissociation and conversion? So there are a lot of theories. Among that theories, two theories are very important, and it is a reliable thing, like psychodynamic and behavioral theory. The psychodynamic theory is telling that failure of primary defense mechanism is the reason behind your dissociation and conversion disorder. Every human being is having some type of defense mechanism to live in the society. Every human mechanism have some defense mechanism. Your mind is having some defense mechanism to overcome the stress, tensions, everything. So the positive and negative defense mechanism of your mental state, okay, is helping you to live and to overcome the stress, to maintain a balance in your life. So that is primary defense mechanism, and any problem in the primary defense mechanism and you have lot of stress and you can control the stress, means in that stage there are chances of dissociation and conversion disorder. So that is the thing which we can see in psychodynamic theory. So or that is the explanation by psychodynamic theory for this dissociation and conversion disorder. Next is behavioral theory. Behavioral theory is telling that it is a learned mechanism to overcome stress. You have stress, okay, lot of stress. You don't know how to overcome the stress. So your mind and body will discuss together and we learn a new technique to overcome the stress. Like you have lot of tension, you have stress, you don't know how to overcome, how to manage, how to face the people. So dissociative fugue will develop. You will lose your identity. You will wander from the place where you are living. You will go to other place, and there you will live with other identity. So behavioral theory and psychodynamic theories are the two theories which is clearly explaining the reason behind this dissociation and conversion disorder. So in conclusion, we can say that to overcome the stress, dissociation and conversion problem will arise. To overcome the emotional conflicts, this situation will arise. Well, coming to the symptoms, for dissociative amnesia, you can see three types of symptoms. The symptoms include localized symptoms, selective symptoms, and generalized symptoms. So localized symptoms of dissociative amnesia means forgetting the events or information to a period of time. To a period of time, you are forgetting everything. That's what this is, localized. Then selective. That means a particular part of the event you will forget. That's what it is, selective. Generalized means you are forgetting everything. Okay. History, identity, everything regarding an event or experience. That is generalized. Next is depersonalization and realization, that I told you what is that. Okay, always thinking about our existence, feeling like we are living in a movie. Always look your body from outside, like whether my body is existing, what is the thing is happening in my body, what is the role of this blood, oxygen, what is happening. So you, like an audience, you will look your body from outside and you will imagine like a movie you will live your life. And always you can see a psychotic stage, like disconnection from the reality. Next is symptoms of conversion disorder. Already we had a discussion regarding the symptoms. So symptoms means physical symptoms. So don't get confused. In dissociation aspect, you will see physical symptoms. You cannot see physical symptoms. So only psychological symptoms you can see. In conversion aspect, you can see physical symptoms. So physical symptoms include blindness, loss of sense of touch, numbness, paralysis, loss of speech, deafness, pain, difficulty in sleeping, loss of smell, and impaired coordination. So these are all the symptoms we can see in conversion disorder. So again, I'm repeating, in dissociation aspect, psychological symptoms are the primary symptoms. In conversion part of dissociation and conversion disorder, you will see physical symptoms like pain and blindness and loss of sense of touch without any proper medical reason. Next is diagnostic procedure. While coming to the diagnostic procedure, history collection, physical examination, neurological examination, and mental status examination. Through this examination, we can find out either it is dissociation and conversion disorder. While coming to the management, psychotherapy and talk therapy. Talk. Communicate with the patient. Allow them to explore their feeling. Okay? Imagine your mind is like a closed room and there is no ventilation in that room. How you will feel? Suffocation will feel. So what you supposed to do there in that moment? Open the windows of the room. That means open the windows of your mind. Once you open the windows of your mind, automatically all the emotions will come out. So communicate with the patient. When you start to communicate with the patient, automatically they will explore their feeling, they will tell their problems, they will try to convey their problem. So when they try to convey their problem, try to catch their problems and give some solutions to their problems. So psychotherapies and talk therapies are playing a major role in the treatment of this dissociation and conversion disorder. Then occupational therapy and physical therapy. Physical therapy for physical symptoms. There won't be any physical reason behind this physical problem. So physical therapy will help them to maintain their mobility, their body movements, etc. etc. Then occupational therapy. Occupational therapy is very important part of management of this dissociation and conversion disorder, because the patient cannot understand what they're doing. The patient will forget everything like what they were doing previously. So occupational therapy will make them to learn new skills like how to cook, how to eat, how to even button your shirt, how to dress, how to do the toileting, how to brush, how to maintain personal hygienic things. So occupational therapy will make the patient to stand in their own foot, will help to perform the daily day-to-day activities which they forgot. Then identify and replace the negative thought patterns, teach new coping strategies, teach self-care techniques, helping the people to express their emotion. That is the very important thing which you have to do in management. Help the people to express their emotions and improve the communication. So communication is playing a major role again. That's what psychotherapy and talk therapies are playing a major role in the treatment of this problem, like already I've told. Okay, so this is about dissociation and conversion disorder. And while coming to the medical management, of course, antidepressant, because the patient will show depression. Then counseling and psychological support. So these are all the treatment modalities of dissociation and conversion disorder. Hope you understand. So in dissociation, you will see psychological symptoms, and in conversion, you will see physical symptoms without any physical reason. Hope you understand, guys. Thank you.